Capture, code, and charge all in a single click. Welcome to MediMobile's innovative solutions designed to increase revenue. Integrated with your EMR, including ADT and MDM feeds, we automate patient population, ensuring your workflow is always up to date. We can fully integrate with your existing billing system for smooth operations. It can take less than 30 seconds to bill a patient with MediMobile. Need a personalized approach? Customize your preferences and workflows to fit your specific needs. Our system reads your documentation and provides CPT and ICD-10 diagnosis codes and levels. Our charge review process is complete with dashboard monitoring and insurance mapping. And you're never alone. Each client is assigned a dedicated account manager, offering personalized support and guidance every step of the way. Experience the MediMobile difference. We're trusted by over 30% of hospitalists and used in over 25% of U.S. health systems and physician management groups. With an average 10 to 15 times return on investment and a typical payback period of just 1 to 3 months, MediMobile's automation saves you 10 to 20 hours a week, freeing you to focus on what matters most, your patients. MediMobile, your partner in healthcare automation. Streamline your workflow, optimize your revenue, and experience the impact today.
Good afternoon. Thank you for taking time to join us today. My name is Christy Clark. I am a part of the MediMobile team here, and I would like to thank you for taking time to join us today. Today we'll be going over our Genesis platform and how easy it is to maneuver through for you and your providers. Let's go ahead and dive in. We'll take note right here that we are signed in to Stacey Astor's account. If she wants to have over her name, it does give us the ability to log out. Right next to her name is going to be the messaging icon tool. This is a HIPAA compliant messaging tool that she's able to use to message her colleagues, admin, staff, anybody that she needs to in a HIPAA compliant environment. Next to the messaging icon tool, training videos will be loaded for the providers, admins, and billers based on the type of profile that they're set up with. Now this right here is going to be our dashboard. Some call it homepage. And this right here are going to be considered our widgets. So when the provider first signs in, they will be given these two widgets, which is our active list platform and then our active list confirmed versus unconfirmed platform. Right here, it's automatically going to default us to Dr. Stacey Astor's account. If she was seeing patients at multiple facilities, it would be here in the drop-down box. In this instance, it's just set up with that one facility. It does show us right here that she has 5 encounters for today that she needs to address. And with that being said, right here, the first encounter is going to be Sophia Davis. What came over from the hospital's EMR system is going to be date of service, MRN number, account number, and facility. Now, the system does take about 90 days to learn the way the provider is documenting. In that 90 days, a lot of this does get resolved. So our staff will be providing weekly feedback to your team in regards to the way the documentation is being read. So like I said, a lot of this does get resolved within those first 90 days. But what this is telling us right here is that we need to get a little more specific based on the information that was provided. They weren't able to suggest a proper diagnosis code for this right here. So it tells us refinement is required. We're simply going to hit the word change. And it'll bring up the refinement tool. It wants us to make just a few selections. And then it does, after that refinement is done, it does turn it green. We do want green and orange because that is going to allow us to approve the bill. We're trying to stray away from the red. And like I said, that would not allow us to approve the bill until that refinement is made. Now it does turn it a different color and it brings it to, it tells us it's completed. It tells us charge will confirm 2 days after it was created. Now, with that being said, that is completely customizable, that time frame. The most common turnaround time we see is 48 hours. However, when you're getting set up, your implementations team will ask you how long you want it to be in the unconfirmed status prior to confirming off to your billing team. All that's meaning is that this provider can come in here and make adjustments to the bill for the next 48 hours before it goes off to the billing team. We'll take a look at another one right here for Olivia Smith. For Olivia Smith, a data service, MRN number, and facility did come over as well. If the provider wants to go back and look at the documentation that was written up on this patient, they would simply click the sheet of paper, and it does bring us up the actual notation that was written out for this patient. So if they want to reread what they wrote, they're able to do so without having to log into the hospital's EMR system. We do follow the CMS guidelines, so below every charge will be the scoring guideline, and the provider is able to see how well their documentation did score. So right here, we'll take note that it allows us to just approve the bill. And that charge now has been completed and would sit there for 2 days for 48 hours before auto-confirming onto the billing team. If the provider is maybe a bit behind, they can either hit the arrow back or click on the actual word today, and it will bring up the calendar, and they can go back and see for previous days. So that is how they would toggle back to make sure they didn't quite miss anything. I can tell it back to grid, and it's going to collapse that widget for us. Now, right here, the active list confirm versus unconfirmed widget. I'm going to click anywhere in the blue circle, and it's going to bring up the 9 charges that Dr. Stacey Astor has sitting in the unconfirmed status. So remembering that while they're in the unconfirmed status, the provider does have the ability to come in and make any changes, corrections, or edits if they want to prior to going out to the billing team. However, nothing else is required to be done because it will auto-confirm out after 48 hours because that's how that organization is set up. However, if they're needing to get this off to the billing team, maybe end of the month is approaching or they were a bit behind on their billing, with just a few simple clicks right here and then telling it to confirm, those 9 charges now have gone off to the billing team. Pretty simple and user-friendly. I do want to take a quick moment to show you our reporting system. MediMobile is known for having a pretty robust reporting system. We have reports built just about around any thing that you're needing to track. Our most common report is going to be our classic report, which has patient and billing information. It's quite a large report that you can run for certain dates of service, and it would pull you the patient and billing information. We have reports around billing, census, charge analysis, and many other things. So if for whatever reason you don't see a report that you're needing to track a metric on, you simply would get with your account manager, let them know what it is that you're needing to track, and we can let you know if there's already a report built around that, or if maybe it's something the team can get done for you. I would like to thank you for taking the time to show you MediMobile today. This was just a short glimpse of how the MediMobile Genesis platform works. You can book a demo on our website or reach out to us at sales@medimobile.com to learn more about our other services such as charge review and data hub services. I look forward to us connecting soon. Thank you.